Keynote 12 was the first one. This was a multi-cohort phase 1 study looking at pembrolizumab in the management of recurrent or metastatic head and neck cancer. This was a standard phase 1 study, so it included everyone with any prior treatments, no certain restrictions. But what they saw was that there was a pretty impressive response rate and much better than you would expect from standard of care agents. The subsequent study with pembrolizumab was Keynote 55. This study specifically focused on patients who had disease that was refractory to both platinum and cetuximab. This is a particularly interesting group because those patients really have no options. The only historical comparator which has been used amongst those patients is methotrexate, which has a response rate of about 5% or lower and significant toxicity. The PD-1 inhibitors have a lot of benefits there because it actually has very little toxicity and significant activity. So the response rates in Keynote 12, which was that multi-cohort phase 1, and Keynote 55, which was this specific subgroup, highly ill, highly pretreated patients, were pretty much identical. That was really reassuring to show that this is a different treatment paradigm. At the same time that we presented Keynote 55, Checkmate 141 was also presented. This was a randomized phase 3 study that compared nivolumab to 3 different chemotherapeutic options for patients who had platinum refractory head and neck cancer. The investigators had the choice of giving methotrexate, which I described as a wonderful choice, or docetaxel or cetuximab, and it was up to the investigator. That study in a randomized phase 3 setting showed an overall survival benefit for nivolumab versus investigator's choice chemotherapy. Based upon Keynote 1255 and separately based upon Checkmate 141, both nivolumab and pembrolizumab are currently FDA approved for the treatment of head and neck cancer after progression on a platinum.